Hey pilot, welcome to launching. Today we're going to talk with Dr. Bill Beninati about what he carries in his emergency kit while paragliding. As we get further and further away from training hills and civilization and therefore emergency services, what Bill has to say becomes much more important. I'll let him introduce himself and talk through his kit.
Okay, so this is Bill Beninati, just talking about a simple, practical medical kit that you can carry with you in your paragliding harness. My background, I'm a critical care physician and I'm a medical director for a helicopter EMS service, years in the military. So my recommendations, number one, doesn't need any equipment, is the first thing you need to attend to is the safety at the scene, right? And the second thing you should look at is if a person has life-threatening bleeding, you need to stop that right away. Beyond that, it's professional rescue and getting the patient comfortable, so the victim's comfortable. Some of the things that that I carry from a safety perspective, indispensable, obviously you've got to have a beacon that allows you to text and communicate and share your location.
This is the most commonly used one today. It's made by Garmin and called the InReach Mini. There's a second version that just came out, although I'm not sure it's materially different. In any case, GPS beacons are required for just about every cross-country oriented paragliding race today.
You may be early in the morning, but you don't know when it's going to turn to night, so definitely carry a simple little headlamp with you. Just safety stuff, and then a multifunction tool. You don't know what you're going to need to get there. In terms of stopping bleeding, this tourniquets work great. Tourniquets save people's lives. If you're in doubt and you can't stop someone's bleeding, put a tourniquet on there. And you should use, if you can get a hold of one, you should use a purpose-built tourniquet. They're much better than an improvised tourniquet. Those work down on your extremities, right? If somebody's got bleeding that you can't control. If you've got bleeding from a junction, right, you can't get a tourniquet on the groin, you can't get a tourniquet up in the armpit or on the neck, then this is something called quick clot combat gauze, right? This is simple gauze that is impregnated with nanoparticles of kaolin, which makes your blood clot. And so you Z-fold this on to the site of bleeding, hold pressure for a couple of minutes, and it will stop arterial bleeding.
What is Z-folding?
Z-folding is when you take one layer and move over another layer and move over another layer, so it's like a zigzag all the way up. Because you want to get as much of this stuff on the site as possible while holding pressure. So that's just a simple technique.
Got it.
To be able to do that.
In case his gesture didn't make a lot of sense to you like it didn't to me, Z-folding is just folding like a map. But when he talks about slapping his hand, he means putting pressure on the wound, putting another layer on, pressure on the wound, another layer on. And when he says getting as many as possible, what he's talking about is making those folds smaller. Again, pressure, 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 pressure.
For less serious bleeding, this is it's called an emergency bandage. It's a compression dressing. And so what it has is a sterile, it's got a sterile gauze that you put on the actual wound, and then it wraps around there, and it's got a plastic piece on it. The instructions come on the back. It's got a plastic piece on it that allows you to crank it. The last time around, you crank it down and put pressure on there. Some parts of the body, internal bleeding, there's little that we can do. The one form of internal bleeding that a paraglider should be able to deal with is pelvic bleeding. And if somebody has pain around here, they've sustained a significant injury, it's a good idea to just put on a pelvic binder. The thing that we all carry are the cinch straps. When we fold our wing up, those cinch straps, put that around the person's lower pelvis, about the point of their hip, and just tighten it up. The idea is that if a pelvis is fractured, if you can pull it together, it will contain the bleeding, and it'll help stop the hemorrhage that you could not otherwise get to. And by the way, it also makes the person a lot more comfortable to have that fractured pelvis pulled together.
That sounds excruciating on the tightening part.
you know, for a second, but it's a lot less excruciating once it's done there. Once that broken pelvis is snugged up together and not moving, pain goes way down. Another thing you can do to help stabilize is a SAM splint. They come folded up like this. They come in different sizes. This is the size that I carry. You can do an awful lot with one of these SAM splints to help stabilize somebody's fracture. And this is what they look like when they're unfolded. They are malleable. They're foam, right, for comfort and to protect the skin, and they are completely malleable. Something else I carry, you probably shouldn't be doing this unless you're trained for, is just some suture material. If somebody's got a big laceration, I will clean it out and suture it up for, you know, just for sterility. Again, you're dealing with people's blood and body fluids, some gloves here. And then I do carry, this is just the brand that I pick, Adventure Medical Kit. It comes in a little nylon zip bag like this. It's got some extra stuff in there like tape and little things of ibuprofen and acetaminophen that you can use to help, you know, treat somebody's pain in a safe and legal way. And some little electrolyte tabs.
And then what is this guy?
So this is a kit that's produced by the American College of Surgeons Committee on Trauma. One of the things that they have done is to increase the public awareness of people bleeding to death, because that's the most common preventable cause of trauma death, is bleeding to death. So you can take about an hour-long course. They're offered all over the country, and you can get this little kit. You can buy the stuff for this kit individually, but it basically has what we've seen here. It's just if you want to assemble it by ordering individual components, it would cost you less money. But there's a little instruction sheet in here. There's a tourniquet, there's quick clot gauze, there's a pressure dressing.
So what of this do you carry when you fly?
So I carry all of this. All of this goes in a little kit bag that I take with me when I'm flying. It doesn't weigh more than a couple of pounds, and it allows me to deal with immediate life-threatening emergencies.
Well, thank you, Doctor.
You're welcome.
Thanks for watching, and thanks to Bill for providing his expertise. I don't carry a kit at this point in time, but having talked with Bill, I'll be assembling one soon. Let me know in the comments below what you carry in your kit, or why you don't carry one, and if you're thinking about it. Hit the like button and subscribe and all that for the YouTube algorithm and yada yada. And as always, have fun, be safe, and I'll see you in the sky.